Hey guys, Dr. Gabriel Long here from Awaken Chiropractic. I am one of the doctors here on staff that will be working with you. I want to invite you and thank you for coming to the second appointment. It's called the Principal Doctor's Report. What today is for is to help you understand exactly what's going on with you. So I'm going to hit it from a 30,000 foot view, but one of my team members is going to be sitting down with you one-on-one, going over our analysis of your evaluation and exactly what we need to do. I know this can be a little bit unconventional, but we do see a lot of people, and there's a certain amount of education necessary to make an informed decision. I do feel like a lot of the times doctors don't educate their patients on the cause of what happened, so they never fix the thing that's causing them to feel the pain or the symptom that they've been experiencing. So my goal today is very briefly help you understand how we're going to help correct the problem that you have. The body is designed to feel good and function good. That right there is the foundation to everything that we do. Your body is self-healing, and if it's not self-healing, there's nothing else that you can or need to do because your body's not going to improve. You have to be working functionally within your system. Your brain controls everything your body does by sending information down your spinal cord, and that's protected by your spine. So if we took x-rays of your spine when we did your exam on the first day, it's because we're looking for any misalignment that you have, and if that misalignment's caused any arthritis or changes in your spine. So when we look at your x-rays today, there's two things I want you to look for. I want you to make sure that your hips are level and your spine's vertical. It's pretty obvious to see here that the right hip is dropped more than the left, and that there's an abnormal sway in the spine. Okay? That's number one, is overall alignment. You may also see that your neck is straightened out, which puts a ton of tension, and that only happens when a bone's been shifted out of alignment for decades. As we look into the spine here, when we go joint after joint, I want you to look, this is the second thing now, is the health of the joint. This vertebrae is obviously smaller than the other ones in the neck. That's called spinal degeneration or arthritis. If you have this, that is permanent damage that must be maintained and preserved. And the only reason that that happens is when a bone shifts out of alignment and gets stuck for upwards of 20 to 25 years. So it tells me how long that misalignment's been there. So we know it's been there with time and repetition. It's going to take time and repetition to correct, especially with all the scar tissue that can be around there. So when we make recommendations for you, when the team reviews this with you, you don't be surprised if you have this on your x-rays, if we're seeing you 2 to 3 times a week early on to get that scar tissue off your spine. You will not realign your spine until we have that scar tissue off. So it's extremely important early on, even though you may be coming more frequently, to get every single adjustment. If you need to move an appointment, it's not a big deal at all, okay? You have a page in your handout here. You have a page that goes deeper into spinal degeneration. I don't really want to go too much deeper than that because we can get overwhelmed with the information and the details of it, but this has a big part into how much care you need on the front end. And remember, if you have spinal arthritis or degeneration happening, it's not just static, it's continuing to progress, and if we don't fix the reason why, it'll just continue to do so. These misalignments that you have in your spine can also compress the spinal cord. So revert back to the neurological assessment that we did on that first day. We did put a copy of that in your booklet as well for you to reference. When we put together these recommendations, there'll be certain checkpoints where we're going to reassess how much pressure we've gotten back off of there and making sure that you are on the right trajectory to hit your health goals. So when you review that with the team member, you'll be able to see how many assessments and how frequently we will be doing those. That's where we'll also be checking in with your symptoms. We're not going to ask you each time that you come in here, how are you feeling today, John? Or how are you feeling today, Miss Gina? Because the truth is, I'm not going to adjust you where your pain's at, and it's not about the pain. Right? It's about how your body's functioning overall. So when you lay down to get adjusted, here in just a little bit, you'll get your first adjustment if you want to. We're going to use something called the integrator. Think about a guitar string. If you strum a guitar, how it vibrates and you hear a tone. When you compress a nerve and a bone shifts out of alignment and puts pressure on a nerve, a lot of people like to think about that like pinching off a hose and it's slowing down the water so the garden rots. The truth is, when you put pressure on a nerve, it changes how that nerve fires, much like putting pressure on a guitar string changes how it fires. So if the nerve is not firing appropriately, the organ and the muscle will never work. What this does is it disconnects your brain from communicating through the nerve. The integrator is what we use to adjust, and this is designed to reset those nerves that are firing inappropriately. So it's like going into that guitar string and changing, then twisting at the top there to tune it to the perfect frequency so you can hear the tone that you want. What this is going to do, it's going to preload we're going to place it against each nerve that's not firing appropriately today, and it's going to fire in at 1/10,000th of a second, putting a vibration through that nerve at 64 hertz. And we can go deeper into this at another time, but that frequency is going to reset the way that the nerve fires so that your brain can communicate through that nerve appropriately again. This will allow your muscles to contract the way they should. Long term, with your muscles contracting, you're going to see your spine start to realign. The first phase of care is getting your nerves fully firing. You may need to see us again multiple times a week in order to accomplish that. The second phase of care is where your body will actually restructure, similar to having the braces on your teeth and now they're pulling into alignment. So think about the first phase is getting the braces on your teeth. The second phase is them actually restructuring. So later on down the road, if we took x-rays, we sure are going to take x-rays again to track that progress and make sure that that long-standing misalignment is going back into alignment, which will, again, not just help you feel better, but keep you feeling better long term. And everybody's got a different goal, right? But we try to tell people, don't get adjusted for you and don't get adjusted for your pain. Get adjusted to be at your best at all times so you can serve your family and you don't have to put yourself first. Look out your window. Look at the average American going through life. We're not living, we're existing. And it gets to be, we work really hard throughout our life. Some event happens that prevents us from doing what we want to do, and we never get that back because we haven't been creating health along the way. We've merely just managed sickness. This is a healthcare facility. We're going to create health here. We're not going to manage and treat your symptoms. But the great thing is when you create health, your central nervous system is designed to manage and treat those symptoms on its own. If you get to your second reassessment, the second reassessment is extremely important. If you're not feeling better, it's not that chiropractic's not working. We'll track that and we'll ensure that your body's improving. We may need to add something in addition to chiropractic, potentially therapy, massage therapy, acupuncture, massage. Maybe we need to start doing better with our lifestyle choices, guys. Maybe we need to eat better. And we can all look at ourselves and talk about things that could improve. Maybe we need to start hydrating or exercising. If we're not filling these cups and we're not improving, or if we're filling these cups and you're improving and you want to take it to another level, these lifestyle choices so much of the time contribute to us continuing to flare up. So I don't want you to start worrying about whether chiropractic's not working or not. We'll analyze that and we'll help you along the way. And if we keep that variable controlled of getting your body working, it's just a matter of when you heal, not if you heal. But if you want to progress faster, we got to eat well and sleep well and move well and drink well and think well. And the truth is, this is coming from a 32-year-old doctor. I haven't been where a lot of you guys have been, but I started as a patient in chiropractic. I broke my femur in 2004 and my body was destroyed. And I had a chiropractor look me square in the face and said, if you do not get care now, the trajectory of your life and who you're going to be long term is going to be a very rough path. But if we can correct this at its root and you can maintain that, the life that you can live can be unaltered from that injury that you occurred. And it woke me up. And when it came time to decide what to do with my life, I decided to open this practice with my wife. We did so in 2017, and we built one of the largest practices in the state of Nebraska simply by leading with our hearts, right? Guiding you as if I was you and I was in your position. If you were my brother, my mother, my grandma, my sister, my daughter, I treat you like your family and I make recommendations to make sure that you have the experience that I did. Okay, so we're going to make sure that you get the results, but it's going to be a team effort. If you don't show up, I can't help you. Right? If you're not doing your part to make sure your body's hydrated, we got to take responsibility for that. But I understand with me being a younger doctor, there may be some things about your life that you're not willing to change, and that's all right. It's about progress, it's not about perfection. I understand that there's certain things that are easy to change and there's certain things that are hard to change, and whether you decide to make those lifestyle changes is going to fall on you, and that's an okay thing. But here in this office, I'm going to control the one variable that I can for you. I'm going to take pressure with every single adjustment. I'm going to take pressure off the nervous system and allow it to operate and adapt the way it was designed to, and allow your God-given ability to heal to take back over and let it do its job for you. When you cut yourself, you put a bandage over it, you don't even have to think about it, the body heals. We want to empower that system and that force within you to do its job. And when you let it happen, your spine's going to realign, your body's going to start to work, and you're going to get everything that you've been searching for, as long as you can stay dedicated to the principle and allow yourself to heal long term. That's what it's all about. So I'm going to have a team member come in here in just a minute. They're going to review any questions that you have from your images, if we took any, or your neurological assessment. and go over our recommendations for care, discuss financials and insurance and how we can help make care affordable for you with any payment options, or and then answer any questions about how chiropractic specifically is going to help you as well. They're going to take you up front, get everything set up. They're going to get you a swipe-in card, and then from this point forward, your adjustments are going to be extremely efficient. You'll come in, you're going to swipe your card, it's going to check you into a room. We're going to get you adjusted. The adjustments are going to only take about a minute or two. Then we're going to get you back to your busy life and get you healing and on the road to success. So I will see you in the adjusting room in just a couple minutes. Thank you.